Hello, everybody. My name is Dr. Kash Abdullah. It is April 27th, 2020, and today we are still dealing with the coronavirus pandemic. Also, if anyone wants to ask me anything, they can be free to ask. Let's see. There is one thing I wanted to do real quick. And let's see. Let's go. With that. There we go. Okay. So, let me change view here. Okay. So this is today we have over 3 million cases of coronavirus, and of total confirmed cases in the world, about 3 million. The daily increase in cases in the world is beginning to hopefully plateau. It looks like that is now the case. The world is now plateauing. The US is close to 1 million some odd cases, which is now essentially 1/3 of the total confirmed cases. So that's now outstripping literally every multiple countries, almost even I think Germany and Turkey may be involved. Maybe not. But the US has unfortunately 55,000 deaths. Their curve is also, their daily increasing is plateauing, but it's still there. Spain's has been falling just as before. Italy continues to fall, and likely they should be coronavirus free by, I would imagine, end of May, end of May, beginning of June. France is also lowering the curve. They may flatten the curve actually also by mid-May. This one outlier really makes things difficult to tell where they're at. The United Kingdom is essentially flat, well, not flattening their curve, but they're plateauing like the US. Their numbers are not as high as the US. The US has literally like 40,000, whereas the United Kingdom only has about the max 10,000. Really, they're averaging about 5,000, where the US is averaging over about 30 some odd thousand increases a day. Germany is almost flattened completely and finished this. They should be ending this by middle of May. I think they'll be the next country after Switzerland and Austria. Looks like Turkey's also beginning to flatten the curve, lower their daily increases. Iran is also. Russia is still spiking higher, and they're trending up. China's that's just lies. Brazil is spiking up. They're just increasing exponentially. So let's see, what's Canada. Canada is beginning to also, like the US and England, is beginning to essentially plateau, but their total number of cases is not that high. Around every day there's about less than 2,000 cases, but the country is only 37 million people. Belgium is beginning to also trending down. Netherlands trending down. Switzerland is almost nothing. Is almost finished. So I would imagine like middle of Switzerland's almost there. India is going higher and higher. And let's see if there's any questions real quick. No questions. Okay, India. Someone was mentioning was supposed to be going higher and higher. Now it's not. No, someone was mentioning that India was their use of ventilators. They only have, like in Bombay or Mumbai, only has 250 some odd ventilators or something. And I said that's very small amount in the first place. And they said, oh, they're not being all used. And I said that likely it's going to go increasing. So you'll see it's an increasing trend. And there's only 2,000. I would imagine it's way more, but the number of tests I would imagine are much less. Peru is also just like Brazil. Where's Ireland? Let's see. Ireland is trending down. Sweden is also essentially up to about 500 some odd cases. Saudi Arabia is, well, it's trending up completely. And Israel, let's see where's Israel going. Israel's Also flattening is beginning to trend down. Austria is essentially almost nothing. And I recently read New Zealand. Where's New Zealand in this? New Zealand stated that they have essentially said they've conquered the coronavirus, and you can see that yes, they only had 19 deaths in the entire country, and they had one case yesterday, like maybe yesterday or something, or 2 days ago, one case yesterday. So they've essentially flattened the curve. They've completely eradicated the disease likely in their country, but they have to they're lifting their I think their stay-at-home orders. And let's see, where's Australia? Where is Australia? I know Australia's here somewhere. I missed it, I think. Australia. I'm not sure where Australia went. It's here somewhere. But I know they also have flattened the curve, essentially. Maybe just click Australia or something. That didn't work. Oh, there's Australia. Australia is also with only 83 deaths, and I think they've essentially also. Yesterday they only had 20 cases, not deaths, 20 cases. So, and where's new? Where is? Let's see, where is South Korea in here somewhere? There's South Korea. So South Korea essentially, just like yeah, it's 10. So New Zealand, Australia, South Korea, Austria, and Switzerland almost have basically completely. I would imagine South Koreans have essentially lifted many of their issues. It's just that now the U.S. is the biggest. Not now, but the U.S. is of course the number one. Let's see, is there any new? Let me actually. Let me go here. Actually, let's go here for a second and close this for a second. Let me see if anyone from here wants to speak. Let's see. Let's see. Hello. Let me see if these people want to speak. Ask anything. Let's see. Ask anything. Let's see. Let's see. Answer. Virus questions. I don't know if this will work. Let's see if anyone came to the channel from that. So let's see. Well, all right. So let's see. And then I want to go over the symptoms of coronavirus. There is the new symptoms have come up. The CDC has recently given out. We know the old ones: fevers, cough, shortness of breath. New ones are now chills or repeated shakes with chills, muscle pains, headaches, sore throat, or new loss of taste or smell. These are the new issues. So muscle pain, headache, sore throat, new loss of taste or smell, chills, repeated shaking with chills. So if you start experiencing these things, then these are the new symptoms, especially when you have a combination of them, not just one. Just headache alone is not going to give you coronavirus. We're going to have to look for a compilation of symptoms. So let's see. Oh, there's some new workers. Hello. Let's see. Oh, hello. There is a new person that just joined in. Um, Someone from gaming. Royal Lab Stats. Oh, hello. So if anyone has any questions, they can ask. Um, let's see. Oh, it's hi there. If you have questions, you can ask me right now. Looks just like you and me, and maybe someone else. So I'm Dr. Abdullah, and I'm just answering questions. Here, let me show you what I look like. Since you're new to the channel, I think. Hello. So I'm a physician here in San Jose, and I've been live streaming for about the last month. And if you or anyone else you know wants to answer questions, I talk every day at 12:30 to 1 o'clock. And if you have questions, yeah, I go over various stats of. Let me go back here. So I go through various stats regarding coronavirus, and if I go through these. I talk about flattening curves. I talk about symptoms, and then I also talk about other issues from regarding any medical topic, really. Headaches, nausea, vomiting. If you have, you can ask me anything. So, and I do this from weekdays from 12:30 to 1, and if you have any questions, feel free to ask. I'm new to the channel. Not new to YouTube. I've been doing YouTube some time, but I've been branching out, doing more of medicine topics. I do sometimes car topics, but yeah. Can COVID have nausea as a symptom? Well, not maybe. Generally, if you've come to your primary care provider and you say I have nausea, no, you don't. We're not going to say, oh, you have coronavirus. You have to. These are the new symptoms that I want to show you that would possibly be for coronavirus. So fever, cough, and shortness of breath were the recent ones, were the old ones, sorry. And now chills and repeated shaking with chills, or really muscle headaches, or sore throat. Or new one is new loss of taste or smell. So coronavirus is more of a upper respiratory kind of symptomology. You're not looking at anything. It's not, nausea could be is not really a symptom. If you come to our primary, we're not going to think, oh, I have nausea, doctor. That's not automatic. That could be a lot of things. It could be just reflux. It could just be you have a headache, or not a headache, but just it could be anything. But that nausea is a very random symptom. It could be just food poisoning. So no, that's not exactly a symptom outright. So it's okay if you have some nausea. Everyone's having some nausea here and there. Let's see. Let's close that. But let's close that. But yeah, nausea is not generally a symptom of coronavirus. So let's see what else. Let's see. Okay. Let's say I can. To ask live questions. About coronavirus. There we go. So, yeah, Royal Lab Stats. I don't know what Royal Lab Stats. Oh, you're welcome. I just saw that. Yeah, I'm not sure what Royal Lab Stats are. Is that the new gaming channel? I play a little bit of games here and there, but let's see. What else can we? So, I wanted to talk about. Let's show the news for coronavirus. There we go. Let's see. So the latest news for coronavirus or COVID-19 is this is, since I'm in the U.S., I get U.S. news a lot. There's a lot of issues regarding, now people may ask me what do they feel about regarding opening up the states some of the states in the United States are opening up, even though they're premature, I think, in opening up their states to coronavirus. And I think the reason they're doing, well, obviously the reasons they're opening up the coronavirus issue is um, that there's a big financial problem, and I think that's a little bit. We have to remember that people are the one that make money, and if people get sick, then what economy can we have if people are sick? So, oh, let's see. Oh, we have to go. Oh, sure, of course, you can anytime. Anytime here. Remember, 12:30 to 1 o'clock. I'm here on weekdays. Thank you for coming. I appreciate it. So, let me go. Maybe do that real quick. Thanks. But yeah, thank you. And you were, let's see, who you are. Jalopa Gaming. Thank you, Jalopa Gaming. Hello. Um, let's see. Let's see if there's any other questions. Let's see. Let's see. What else can we talk about here? I wanted to. Let's see. Let's actually, if we go to New Zealand. So I was speaking about New Zealand losing. Let's see. New Zealand coronavirus. So yeah, the biggest news is New Zealand has essentially they've said that they have successfully stopped the coronavirus, and I believe they did it likely through contact tracing, frankly, and stay-at-home orders. Let's see. This is 2 days ago. It says it's one. Let's see. This is NPR speaking about this. If there's any questions, no. Let's see. NPR is stating. Let me switch pictures again. There we go. There we go. And so let's see. Let's see. There's no widespread detected community transmission in New Zealand. We won that battle, but we must remain vigilant if we are to keep it that way. So let's see. It looks like that what they did was declaring the virus eliminated, but did not mean that there were no new cases, but the numbers would be manageable with the help of aggressive contact tracing. So they have been doing aggressive contact tracing. So if you're asking what is contact tracing in general, so contact tracing is this. So contact tracing is so the best way we can manage coronavirus is by doing contact tracing. And contact tracing is when so a person comes into a hospital or wherever, and they check out this. They give, oh, I have fever, cough, shortness of breath. They test them, and they test out positive for coronavirus. If that's the case, then what they do is, okay, they quarantine that person first, and then when they quarantine that person, they then send that person. They then ask that person, who have they recently met. And from that, they then go to those people and talk to those people and ask them, of you people who you've recently met, they let them know, hey, by the way, this person has recently tested positive for coronavirus. Do you have any symptoms? And if you do have symptoms, come back and let us know. So what happens is those people say, yes, I do have symptoms. They're tested. And depending on maybe it may come down to if they have enough testing. Even if they don't have symptoms, they might even test. Because frankly, I think the test should be easy, just given during contact tracing. During contact tracing, you should give the test no matter what. Oh, let's see. Oh, look. So let me just finish the contact tracing, and then I'll speak to you, Jalopa Gaming, about this last question. So in contact tracing, once you have determined who is positive, then you go back to those other people that person has tested positive. You keep going back and back and back, seeing who has tested positive, and you isolate those people who have tested positive. And that way you stop the virus. And so the most successful countries, South Korea did this, and now it looks like New Zealand is doing this. I would imagine Austria is doing this, and I believe Australia, who has also conquered this, or almost conquered this, is doing that. And the US, frankly, needs to do this too. Let's see. I have one last question. The other day I had chills and nausea, and there was a bit of a tremor. Is this a stomach bug? I've already stopped feeling the symptoms though. Okay, likely yes, that was a stomach bug. I think if you had chills, depending on the chills or the nausea, it's likely a stomach bug. Biggest thing is if you're concerned about coronavirus or any kind of issue regarding coronavirus, fever. Fever is the biggest thing we use, and a fever is 38 degrees Celsius or 100.4 degrees Fahrenheit. So if that comes out like that, then the next thing is fever alone is not technically coronavirus. If there's a difficulty in breathing or coughing or shortness of breath is the like you can't catch your breath. You literally have to work at breathing. That's shortness of breath, or you just can't get enough air. Now, if you're not tasting things or smelling things, these are the new symptoms that are coming up. That's also a sign of coronavirus. But what you're describing, frankly, sounds like just a stomach bug and nothing more than that. So, you know, it's not. I would say that if you stop feeling, that's good. So, you know, symptoms is so in medicine we have objective and subjective and objective symptoms and ways of figuring out things. So subjective is what you tell us. I feel like this, I feel like that. And objective is something that we can like measure, like a blood pressure, a fever, or us seeing how many times, how often, how fast you breathe. That's an objective test. Let's see. I almost never have fever for an illness, and I don't know why, because I have checked with the thermometer and it says no fever. Okay, that's good. Okay. Just because you don't trust me, this is going to bring out a fever. This virus will bring out a fever in general, almost all the time. I've never heard of not having a fever. So I don't think you have coronavirus in general. Now, I would recommend you do you do social distancing, and wearing a mask now outside is a good method. Now, I remember we were saying in medicine, and the CDC and what have you, World Health Organization, was saying, wearing a mask in general is not good. But, guidelines change. And there was some people were mentioning how touching the mask, if you're wearing a mask, gives you more instances of the disease. But medicine in general is not an exact science. It's the more information we get, things change. The way we bring about. And sometimes, insane may sound like we're going back on what we're saying, but it's not easy. Trying to give people the best advice is not an easy job, I can tell you. That's what we would like. I will, whenever I see a patient, I will go back and read journal articles to see what is the best way of treating a person. So, this is, but yeah, I think it's okay. Even if, I know you're saying you don't have fevers, but let's just check. Oh, you're welcome. Can you also type the schedule for the live stream just in case? Sure. Let's see. I can type it right here. Live stream is from 12:30 to 1 o'clock p.m. That's Pacific Standard Time, California time, so West Coast. Oops. And weekdays. Like there. Weekdays. So I'll try to put that somewhere. But yeah, it's a weekday thing. I do it from 12:30 to 1, as long as it's a stay-at-home order. I'm at home. And it's Pacific time zone. So I live in California. So that's why it's this time. But yeah, thank you again for coming in. Thank you, Jalopa Gaming. I appreciate it. I'm still getting the hang of this live streaming. I really appreciate the views. If you can subscribe and join all of you. Oh, you're welcome. Thanks. So, there's something called rating. I know we only have 2 viewers, and Jalopa Gaming, you're leaving soon. But if you have a place, if you know other doctors, I like to also contribute with other physicians. The more information, the better. And like I said, it's not only about coronavirus. It can be anything. So, But yeah, let's see. I'm gonna look at really quickly the live stream. And actually, I'll check out Jalopa Gaming, or I'll check out Royal Lab Stats. I'm not sure where that is, but I'll look that up. Actually, I'll look at it right now. I'll copy it and put it on YouTube. Let's see. Let's see if I can find it. Oh, there it is. Data visual. Oh, wow. I see. I'll subscribe. Okay, I see. Let's see what is else. Okay, well, thank you again, guys. I wonder. I guess I'll head you guys back that Royal Lab Stats. Here, I'll give you their website. Here, let me give you their live stream. Okay, there we go. And here's their YouTube page. I'll mention how I give it to. I'm trying to grow the audience. Okay, let's see. Sending viewers to Royal Stats. I am Dr. Abdullah, who does a Ask Anything every weekday from 12:30 to 1 p.m. Pacific Time Zone. All right, let's see. Okay, well, thank you again. I'm gonna close out the channel. Again, I'll be back next week. Sorry, tomorrow from 12:30 to 1 o'clock. Thank you again. Bye bye.